Hi everyone, it's Jenna Walsh, registered dietitian and certified diabetes educator, here with you today from the Petawawa Centennial Family Health Center. Welcome to our online nutrition class. Today we're going to be looking at a class I did about 2 years ago. I've revised it, we've updated it, and I think it's timely. We're going to talk about nutrition and COPD, okay? And we've started with an overview, a link I'm going to provide you from our COVID-19 and COPD updates. There is a recommended guideline that's available for you. So you can see it. It'll be on one of the slides. Please, if you're struggling with COPD, if you have a loved one who's struggling with COPD, please send them in that direction. As always, this class is solely for information. It is not to replace the healthcare from your physician, your nurse practitioner, or your lung health provider, okay? So again, just for information's sake, and again, updated with some new tidbits. So as we get going as well, we're gonna go through what happens with COPD and as well as what nutrition information we have that's evidence-based to help you. Okay, so in terms of the COVID-19, I'm sure for any of you who are struggling with COPD, with asthma, or any respiratory issues, there's probably that extra layer of fear. Please see this statement that was released about a week ago, okay? Also, please reach out in Renfrew County to your local lung health programs and your coordinators, okay? There are lovely respiratory therapists and technologists that can help assist you, okay? So that link is there for you as well. So what are we looking at, right, when we are dealing with COPD? There's so much, and this is really just off of one of the COPD websites. I think it's fantastic because it really takes a look at what really goes on behind the scenes with somebody struggling with chronic obstructive pulmonary disease. So, you know, I have difficulty doing really simple things like putting my clothes in the washing machine. We take for granted when our lungs are working well, how much use we get and how much oxygen we use just to do simple tasks. My family's always cooked on open stoves in the house, and I never realized that it much caused me such disability. Right now, and again, this is very timely in terms of a side effect of COPD, in terms of the coughing and sputtering, making me feel physically unattractive, but also maybe the social stigma we may get at this time during pandemic of people worrying that you could be sick, right? So it's hard to deal with that. Some friends and caregivers may be judgmental about COPD and that it's self-inflicted. And these are real day-to-day struggles that people are dealing with, and that we may know somebody who's dealing with these side effects, okay? Okay, so we're gonna take a little bit of a dive into like what specifically is COPD. So it is that chronic obstructive pulmonary disease. And it can be a range of those chronic lung infections, or sorry, chronic diseases, okay? So wheezing, coughing, having that tightness in your chest, difficulty breathing. Because our lungs, so if you can see on this slide, right, we have the muscle itself and then the alveoli, which are those air sacs. If in COPD, you can see that the walls of those air sacs become destroyed. So we have less of them, and that way it's a lot more challenging to get that oxygen through our body, okay? We do get an increase in mucus as well in the bronchioles, which makes it more challenging as well. So when we look at COPD in nutrition, right, we know we need food to nourish our body. And the type of food, the type of nutrients that we have, they affect the energy that we have and the amount of carbon dioxide, or CO2, that's produced. We do know that the CO2 that's in our body is expelled or released through the lungs. There's some thought and research that certain types of foods can increase that CO2 production. And we know that the more CO2 that we produce in our body, then the more work our lungs have to do. We can estimate, depending on the severity of the disease, that some people with COPD may need anywhere from 10 to 50% more calories than people without, because again, those muscles are working harder. And the muscles can take, this is an estimation, up to 10 times the amount of energy for those lungs to function in COPD. There's also some statistics that about 24 to 35% of people with COPD are malnourished, okay? And that's in the moderate to severe categories. And so as we're going through, right, so in terms of PEN, which is our dietitian's practice evidence nutrition platform, we definitely see that COPD puts a significant impact on dietary intake and nutritional status, okay? And a lot of this is from the side effects of the disease. So fatigue, having dry mouth, having a poor appetite. It's common to have gastrointestinal side effects as well. And then also dysphagia, so difficulty swallowing. Some of the medications that are standard with COPD can also have those side effects and include unintentional weight loss, okay? So we really have back and forth evidence. There hasn't been fantastic studies to say, here's somebody with moderate COPD, and this is specifically the nutritional deficiency we see in them versus somebody with severe COPD. And so we do see improvements in nutritional status with the moderate to severe with some of the tips we're going to talk about, okay? So the evidence changes in terms of grading based on the types of studies, the quality of the studies, and how they were done. So I just want you to keep that in mind. Okay, when we look at the cycle that we see related to nutrition and COPD, so say we are diagnosed, okay, that breathing may be using more calories for the body than previous, okay? Eating becomes really exhausting. So if you know anybody, you know, with severe asthma, or even if somebody's got like pneumonia, if you know someone, or if you yourself are struggling with COPD, you become very quickly aware of how much oxygen and how much breathing it takes while you're chewing and while you're swallowing. So that step alone becomes really challenging, and for some people can really trigger sort of an exacerbation or more anxiety, which increases our rate of breathing, okay? Exercise is really hard. So right there, if we were really active, if we were busy in our home just doing daily chores, those might be really, really challenging to do. So move forward then, and our weight changes. So we can see across the board weight loss, but we can also see significant body composition change where we may not see the number on the scale jump as much, but we can see significant muscle loss, again, because we tend to decrease the movement, especially the resistance exercises, and our diet tends to change. So we can have higher needs, but also muscle wasting, because without getting the higher caloric intake and protein intake, plus having less movement, we end up with muscle loss, okay? From that, then we can have those COPD exacerbations, right? We can have a low energy that might result in higher carb intake, because typically things like pastas, breads, crackers, you know, buns, they're quick and easy, they're energy dense, right? So they're easy for us to take when we're really not feeling well. And that in turn can and may increase the workload on the lungs. Okay, so it's a pretty tricky cycle at times, depending where we're sitting with our COPD. So really when we look, excuse me, at COPD and nutrition, overall we wanna eat well. We wanna do our best to still maintain that good nutritional status, because that can help maintain our muscle mass, reduce the risk of infection, and really boost our energy as much as possible to try to be as active as we can. We want to drink adequate fluids as well. We need to stay hydrated, and it also helps to keep that mucus a little bit thinner. We want to try to reduce those empty calories, right? If as much as we can focus on a balanced plate. You need to ask for help as well, right? If you're really struggling to cook because it is physically exhausting, find those resources. Reach out to me if you need, and we can look to see what's helpful in your community. Medications as well can really cause some side effects, especially things like dry mouth, weight gain sometimes, nausea, vomiting, diarrhea, digestive upset in general. We can also think things like cholesterol changes, blood pressure changes. Okay, again, going back to the evidence, we do have some data from more observational studies showing that people with COPD can have a high number of issues, those side effects related to the disease, as opposed to just the changes from COPD. Okay, what we want to look at is we don't have a lot of intervention studies yet specifically addressing the management of nutrition and dietary intake related to COPD. So that's still something that we need to look at, okay? As we move through, what should we be eating, right? That's the biggest thing. Okay, so this is pretty simple, right? And I think for most of you who've been through some of my classes, you're gonna notice that this isn't that different than what we would talk about in terms of general health. So we want to try to look at, you know, fish, veggies and fruit, nuts and seeds, you know, maybe some homemade seasonings if you can whip up some jars, and colorful, right? We know there's lots of antioxidants, inflammation reducing nutrients in a variety of veggies and fruit, a variety of protein sources, versus sometimes those foods that we really just want to go to because we are physically exhausted, they're quick, we don't have to cook. These are higher in carbs, they're still high in calories, so they may actually be promoting weight gain, and they're not really giving you the nutrition that you need per bite, okay? So these are totally fine. It's totally fine to grab, you know, a burger here and there, or grab some pizza here and there. But, you know, in the same way that in the general public, we look at doing that occasionally, we want to do it occasionally as well with COPD, okay? So when we're looking specifically why, right, we want to say, hey, in terms of considering less processed carbs, so things like cookies and cakes and breads that have added sugar, you know, still look at things like barley, pulses, your sweet potatoes, things that still have carbohydrate, but they've got fiber and they've got, you know, a bunch more protein per bite, B vitamins and antioxidants to reduce that inflammation. And that may help also to just reduce some of that CO2 load on your lungs. Okay, again, some of that evidence is still lacking there in terms of how much to have versus how much load on your lungs. In terms of, you know, your fish, your chicken, meats, and your nuts and seeds, Greek yogurt, we need that protein. We're going to talk about that in a little bit of, you know, whether or not there's evidence for extra protein. We do know, though, getting adequate protein is needed to prevent muscle wasting. So we need that there to help keep us strong and keep our bones strong as well. And it also helps to keep you full longer, right? Having something just like 1 or 2 pieces of bread, you may find that you're hungry an hour later. And really then you're getting up, you're using that energy right away. In terms of nuts and seeds, fatty fish, fantastic in terms of the omega-3 fatty acids that help to reduce some of that inflammation, okay? They can help with your mental health as well. Rainbow colored veggies and fruit, again, the colors, think in terms of that rainbow, it just gives us a variety of those nutrients that we know help our gut, they help our mental health, and also may help in terms of preventing some of that inflammation as well. When we look at the nutrient needs comparison, and again, you know, we definitely see systemic reviews of clinical trials that have shown some benefit with nutritional supplementation, so oral supplements, giving that extra 300 to 1,000 calories a day can help in people who are malnourished or undernourished with COPD to help with weight gain improve pulmonary function and functional capacity, meaning like being able to walk a certain distance, and overall quality of life. So when we're trying first to do this with food, right, we know we may need that extra boost of calories. So roughly from, around 25 calories per kilogram per day up to possibly 30. It's really the protein that we may see some benefit, because we may jump from that 0.8 grams per kilo per day up to anywhere from 0.1 to 1.2 to 1.7 grams per kilo per day. And of course, that's going to vary. It's going to depend on, what other foods are you eating? What is your activity? Have you had muscle loss? What's the severity of your COPD? So don't just sort of jump into those calculations and numbers. They are specific for people. So please reach out to an RD if you need assistance with that. Okay, we definitely do see some evidence, it is grade C, but guidelines around having smaller, more frequent meals, including with supplements, than sort of 3 large meals, okay? So let's look at symptom management, right? That's the biggest piece we're looking at with nutrition. One of the largest side effects that we see is early satiety and also anorexia. And you may be thinking in terms of the eating disorder world, anorexia really just means loss or low appetite. That can be a side effect of the medication. It can also be a side effect of malnutrition and low intake, okay? So what we want to work on then is having those high calorie, nutrient dense foods first. So think in terms of like, if you were having an avocado or you were having some salmon and a barley salad or something like that, you want to have that first versus like 2 cups of veggies. The veggies are great, but they're not going to give you the calories and protein. So you want to focus a little bit on the protein, some of those healthy fats, and that balance, plus a few bites here and there with the veggies and fruit. Have small, frequent meals. So you want to plan on, maybe eating periods like 5 or 6 times a day, as opposed to breakfast, lunch, and supper. Be good with those added fats. Focus on even like nuts and seeds, avocados, flax oil, olive oil, all of those. Super fantastic, okay? Early satiety, so that is very common as well, and we can be from fatigue. It can also be from slowed digestion. That may be just your medication side effect. You want to have your fluids between meals, right? Fluids still fill up that stomach. So if you're mixing your foods and beverages, that stomach's going to stretch more quickly. You're going to feel full sooner, okay? And again, aiming for those higher calorie, more nutrient dense foods first. Dyspnea is really that feeling short of breath, and it really relates to how you're feeling overall, how you interpret the severity of the disease and your quality of life. And it's huge. It's such a huge symptom to have with COPD. So we really want to make sure before meals that you're feeling rested, you're feeling calm. A lot of people struggling, especially with moderate to severe COPD, have a lot of anxiety around eating because it triggers that feeling of shortness of breath. So take a deep breath, be calm. Know that it's going to take longer to eat. You need to feel okay with maybe a meal that used to be done in 10-15 minutes. It may take you half an hour to 45 minutes to eat in a way that feels safe and keeps you feeling okay. Ready to eat meals are fantastic to have, especially for periods when you're feeling really short of breath, mood is really low, you're feeling really, really fatigued, okay? And that fatigue is another huge side effect, right? The oxygen is struggling to get everywhere in your body, right? So your whole body can feel fatigued. That can also be secondary to poor nutrition as well as a side effect of medication. So it's complicated. We have to do our best, and we manage each meal 1 meal at a time. So again, we're resting before our meals. Ready to eat may be a frozen entree. It may be that on days that you have more energy, you're cooking in bulk and you're freezing so that they're ready to go, okay? And again, eating slowly. Be okay with taking your time, taking small bites, chewing, swallowing, and breathing, right? It's okay to take that pause and take your time. Make sure if there's other people in your home that they are supportive of you taking your time, that it's a key part in you managing yourself and your COPD, okay? Bloating can happen. This can be due to the lungs being hyperinflated, sometimes swallowing air as well. Going back to those smaller frequent meals can help, taking your time, and focusing on some less gassy foods. So things that we know like broccoli and cauliflower and, you know, cabbage or Brussels sprouts, pulses for some people. So like kidney beans or chickpeas, they can increase that natural gas in the gut. So if you're already struggling secondary to COPD, maybe reducing those. Constipation can be fairly frequent, maybe secondary to having low intake or low intake of fruits and veggies or like high fiber foods, sometimes too related to decreased activity as well as decreased fluids. So you want to try to maintain that exercise. And again, reach out to your respiratory therapist in terms of what activities you should be doing and how frequent, right? So maybe instead of trying to aim for a 30-minute exercise once a day, you may do better with 5 minutes 6 times a day, right? We want to look at least 1.5 to 2, if not closer to 2.5 and 3 liters of fluid per day, and aiming for a good balance at each meal of some high fiber foods. Again, it's where your fruits and veggies come in, okay? Dry mouth is a big one, typically secondary to the medications, sometimes related to inadequate fluids. Add sauces to your foods, be okay with gravies, be okay with, you know, adding extra milk or whatnot into your mashed potatoes. Soup broths are fantastic as well. Limit salt, because that's going to attract and pull the water out of your body. And also there are lubricating mouth sprays that can be really helpful, okay? All right, in summary, I know that was a really quick overview. The best thing, you know, I can recommend is with COPD, there's no quick diet to follow. There's no specific guidelines for the disease itself. It's more symptom management. And when we go through everything we just talked about, we're still just following that traditional Mediterranean type diet, lots of veggies and fruit, higher fiber grains, fish, chicken, eggs, lots of nuts and seeds can be great. And trying to just reduce the frequency of sort of more of those treat foods, okay? I added some resources here on the last page for you if you wanted to do some more of your own research, if you had questions, and if you wanted to know sort of where my information was coming from. As always, please reach out to me if you have questions related to nutrition. And again, if you're feeling any complications with your COPD right now, please reach out to your healthcare provider or your local lung health program. Okay, take care, everybody.